record to the cloud. Right, we are live and welcome everyone to the Nora Jane Fit community. Today we have a lovely guest on with us, Courtney. She is a wonderful being and I'm so excited to do an interview with her today. She's a mindset coach and corporate wellness provider, in addition to a trained yoga and meditation teacher. And what I love about what she does is that she takes the principles of yoga and she teaches women how to apply this to their physical and mental and emotional states. So specifically women who are experiencing burnout and high levels of stress, etc. Today, we're going to look at wellness practices for pain management. A lot of you in my group have spoken about challenges with aches and pains that come from some of the workouts that we do. And we're going to sort of pick Courtney's brain to find out a little bit more about who she is and what she does and how we can incorporate different techniques to help manage pain. So Courtney, welcome. Thank you so much for joining us here today. How are you?
I'm doing well. Thanks so much for having me. It's a pleasure to talk with you.
An absolute pleasure to have you. So can you tell us a little bit about who you are and how you got into yoga and mindfulness and meditation?
Absolutely. My yoga and meditation practices actually started from a place of pain for myself. I had been dealing with some health issues for years that went misdiagnosed. I was going to doctor for doctor and they would tell me one thing, but what they would do and suggest wasn't really getting at the problem. And eventually I found my way to a genetic specialist who diagnosed me with a genetic condition. It's a rare disease that does cause some pain issues in primarily the joints of the body, but also can cause some burning and tingling in the hands and feet. And there can be some other symptoms. So I kind of had this moment in my life. It was a bit of a fork in the road moment where I realized, this was a chronic illness, a genetic disease that, wouldn't just go away. And so I realized I could either kind of stay where I was, which was not a great place. I was a bit stuck, miserable, and in pain. I was having some fairly serious pain episodes where, I would be doubled over in pain and, on the floor, not really able to move. And I didn't want that for my life. So I had that option, or I realized I could learn to live better and be healthier and find ways to manage this pain so that this diagnosis didn't take over my life. And that's the option I chose. So part of my health and wellness introduction was realizing that I needed to do some exercise. And I was starting from a place of, very little strength in my body, not a very big active person to begin with. So yoga seemed like a good option to try out for some low impact movement. And as I got into yoga, I started to realize that I could choose classes based on what I needed at the time, which was really important to me. If I had more energy, I could do a more active class and work on building my strength. But if I wasn't feeling that great, I could choose a more restorative class. And that flexibility within yoga was really helpful for me to learn how to manage that pain. I saw that I could learn to listen to my body and adjust what I needed from there. So from there, I kind of became more and more attracted to yoga from just some of that flexibility that I initially saw. And as I went along, I was building that physical strength in my body, but also building my mental and emotional capacity to handle some pain, difficulty, and challenges and manage my stress along the way.
So a few things there. So a genetic condition. Do you mind sharing what it's called or what it is?
Yeah, not at all. It's called Fabry disease.
Okay, I've
And
never heard of that one. Yeah.
yeah, it's super
Yeah.
rare. It's
Yeah.
a lysosomal storage disorder. So this means that my body doesn't have a specific enzyme that is used to break down a very specific lipid fat molecule in the body. So without that enzyme, that molecule can build up in certain organs and can cause pain and some other potential issues. Um, so in a nutshell, that's what the condition is. Yeah.
That's okay. And so that's a chronic one for life. Okay.
Right.
So it got to a point where it was must have been pretty bad for you to then seek out, consistent medical care, even though you weren't getting the right information back from them. And then finding yoga. So how did you decide that physical activity was the next best step for you instead of medication or in addition to medication? Because a lot of people might think, oh, I can, this is something I'm going to live with for the rest of my life. I might as well just self-medicate and call it a day. But you chose a different route. So what was your mindset around that?
Yeah, that's a good question. I was a bit concerned about potential side effects of medications. So I know that there are a couple medications that people with this condition might use to manage the pain and some other symptoms that they might have, but I was worried that those medications could cause me other side effects that would maybe exacerbate other problems or just kind of hinder my life even more. And I just didn't feel like I wanted to experiment with that process of trying out a medication, waiting for a few weeks or months if that would work, and then, maybe trying something else. And I felt like I wanted to have a little bit more control over what was going on in my own health and my own life. So to me, in just where my perspective was, that meant learning how to be healthier and healthy in general because I didn't have much health knowledge and information at that time. So it's a real learning process for me.
What were this? So I like what you said there with being healthy in general. So um I just did a podcast with someone and was, speaking along the same lines. When you look at health, it can't just be a singular entity where you think, oh, I'm exercising, I'm healthy. It's the holistic view of looking at nutrition and stress and sleep and mental and emotional well-being. And if you're addressing all of those, and then you can even tap into like sexual health as well, which is really important. When you're addressing all of those elements and you're healthy in each, then you can say you're a healthy individual. So did you incorporate any nutritional strategies into that as well when you started off your journey? Yes.
I did, yeah. And I had a real learning curve with that as well. So at the time, I was eating a pretty typical um, diet, though, maybe not as unhealthy as some, but I started just by trying to eat more fruits and vegetables, knowing that that was a good starting point, and eventually transitioned into more organic food, more non-genetically modified food, and tried to move into as much of a whole foods diet as possible. So, greatly reducing things like sugar, the processed foods and flours that you might find in a lot of packaged foods, and really transition to whole food, less dairy, and some of those types of things.
I love that. Like right along my lines with everything that I preach. And I would also say adding in like fermented foods as well. But I mean, for you
Yes.
have to know what works for your body and your condition. So that's really good. Did you see any? How did you have any immediate um effects where you were noticing immediate benefits to that, or did it take some time? You did. Okay. Do you want to
I
share?
did, yes.
Mm-hmm.
Before I started this transition, I was having some digestive issues, and I had had that on and off throughout my life, maybe since I was like 8 or 9 years old in school. So, again, they were looking at things like lactose intolerance and different food allergies, but none of those treatments really seemed to work. And the thing that really helped my symptoms was my diet and changing my diet. So once I did move into those dietary shifts, my digestive symptoms pretty much disappeared. It was kind of amazing
I
and
really
in
like
a
that.
positive way to see
Yeah.
such a change. Yeah.
Really like that. I really like that. I think a lot of people get so confused with where to start with healthy eating, and we tend to massively overcomplicate it. You know, you've got all of these different trends and different diets to try. And for people, and sometimes I don't appreciate that, you know, this is what I've been doing for years. But for some people who, you know, this is not their thing, it can be so overwhelming to decide, okay, what is my starting point? Where is point A? And if you just look like at what you said, starting with increasing your fruit and veg intake, I think it's really important. But I would also add, to sort of emphasize, you know, your point with the organic and non-GMO, especially if you're in countries where this is more widely available,
Mhm.
because that also presents a toxic overload to the system, especially if you've got underlying issues as well. Going for the best quality, you know, fruit and veg that your budget allows, because I always look at it as an investment in your health, because this is the only body that we have. This is the only brain that we have, and you might as well just take care of it so that as long as you're on this planet, you're enjoying life and you're functioning as optimally as possible. So, love what you said about taking out the dairy as well from an ethical point of view. Poor cows. Um, that's also really good. So, as you continued on your journey with yoga, what were the benefits to your pain there, and what sort of, did you have like more joint pain or bone pain, or what was the pain like?
Yeah, it was more joint pain for me,
Mm-hmm.
kind of like a full body aching
Mm,
pain,
gosh.
almost like if you get the flu and your body just
Yes.
kind of hurts all over like that.
Yeah,
And
that's
I was
tough.
seeing certain trends. Yeah, it was, kind of getting in the way of my life sometimes, where, I was working at a 9 to 5 job at the time, and I would come home completely exhausted, spend many weekends in bed of just being exhausted and worn out. And I was seeing certain trends about my pain would increase when I was more stressed. And so I started to learn that with yoga, I was able to regulate some of that. And I think that helped because my body was processing stress differently. So in yoga, really moving mindfully and slowing down makes a big difference, so that every movement is done and you can feel what your body's doing all along the way. But coupled with the movement is breathing. And the deep breathing in yoga really helps to regulate our stress response. So when we breathe deeply and do what we call diaphragmatic breathing, where we feel the belly moving as we breathe, the body moves out of stress mode, where in that stress mode we'll be in a high fight or flight state, and our body is producing these stress hormones, getting us ready to, fight or flight, get ready for some kind of attack or the threat. And when we can come out of stress mode and move into that rest and digest phase, where our body is not producing those stress chemicals so much, we are able to let our body systems recover. And so when we recover from that stress, we are able to feel a little bit better. Excuse me. So we have less tension in our body and our mind. And I was really noticing the difference where I could use my breath to, even in the moment, regulate my energy. So if I was having, some moments of high stress and anxiety, doing a few moments of deep breathing before a big meeting or a difficult phone call was able to take my stress down a little bit. And, from that place of having more ease in my body and mind, I could think clearer and, just do whatever my next step was a little bit better.
Okay, so a couple of questions. So with the yoga, do you think it's the fact that you were slowing down and tuning into your breath, or do you think it was that coupled with the movement and the low impact and the flexibility that comes with doing yoga that helped with the pain management? Was it a combination of both?
I think it was both. I think
Mm-hmm.
it was helping in the short term to take down my immediate stress. But then also, when I became really consistent with my yoga practice and started practicing every day, um, I think that helped how my body was regulating stress more in a long-term sense. So,
Did
mhm.
you have a really did you have a really stressful job or lifestyle? And how long were you practicing yoga each day? And you mean 7 days a week practicing yoga kind of thing?
Yes, but that
Mm.
didn't always look the same every day. So, I would give myself the freedom and the flexibility to adapt my practice to what I needed. So if it was an exceptionally busy day or I was very tired, it might just look like 15 minutes of restorative yoga. But if I had some more time, maybe it was a weekend and I had a little bit of more time for self care, maybe I would do an hour practice. Maybe I would even practice twice and practice in the morning and then again later in the afternoon or evening. So I think the repetition and just being on my mat regularly every day was really the key instead of the actual length of time, if that makes sense.
The consistency building it in. First of all, I love what you said about it not being exercise but self-care.
Mm.
Because that really is what fitness and physical activity is about. It is it's taking care of the self. So that's brilliant. But it became more of a way of living for you rather than just something that you were doing as a short-term intermediate tool to help manage pain, which is it's key. It's really important.
Absolutely. And, yoga actually has a lot of principles built into it where we might think of yoga as a form of exercise, but it's so much more than the actual movement. And one of the key elements of mindfulness practice is self compassion and being kind to ourselves. So we learn to pay attention to our thoughts and see what comes up, but then also not judge ourselves at the same time.
How do
And
you not judge? How do you do that?
yeah,
Because
it's
that's
hard.
difficult for people. Yeah, it's difficult for people who a lot of people don't like. I wouldn't necessarily choose yoga as my go-to form of exercise.
Hmm.
However, I appreciate the benefits of yoga, especially like when I was injured and I had a really stressful life, and that presented as adrenal fatigue, and I had to stop. Yoga, it's massively beneficial. So, that's great. Great.
Yeah, it's a challenge. I mean, I think that might even be the most difficult part of mindfulness
Mm-hmm.
because, we can pay attention and choose what we focus on and feel how it feels in our body, but we get very conditioned to be hard on ourselves. I think even especially as women, where we're always trying to do more and be more, and
Perfect.
that
Yeah.
idea of relaxing that and accepting how we feel can be really challenging. So I throughout my practice and what I teach now are just certain ways to kind of work with your thoughts, learning to welcome them and let them all have their time and space, even if it's maybe not a thought or emotion that we would choose, but staying curious around it. Like, what does that feel like? What are my thoughts about that? And knowing that we don't have to choose and follow those thoughts. We could redirect our attention anytime, maybe coming back into our breath, maybe a specific movement in our body, or just wiggling our toes and feeling what that's like, but kind of giving our thoughts and emotions the space to be there without necessarily following them and being attached to them.
I like that as well because sometimes, people think, well, I have to be positive all the time. And if I feel negative, it's a terrible thing. But allowing, like you said, allowing the thoughts to be there and giving them their own space, it's important because then that takes it's almost like a sense of relief. Like, okay, I don't have to do anything. I don't have to try and be anything. I can just be present with what is. That's hugely freeing, hugely freeing.
Absolutely. And
Yeah.
I was one of those people who felt like I had
Mm,
to be positive all the time.
hard.
And
Yeah.
it's so hard to go
Mm.
through life that way because it's impossible, first of all. No
Unrealistic,
one can
yeah.
actually do that. Yeah.
Yeah.
And we kind of miss out on what the things we might call negative could be telling us and showing us too. So if there's a difficult situation that's on our mind a lot and it's really hard to let it go, it's probably there for a reason. Maybe it's something that's really important to you, or a relationship you want to work through, or a problem you want to solve that can lead you to something else. So
Yoga, you're a safe space to sort of allow you to also deal with challenging emotions.
absolutely,
Yeah,
yeah,
that's really good. Really
process
good.
through them in healthier ways than trying to ignore them.
Okay. So carrying on with your story, so you got into yoga, you were practicing every day, and then what happened?
Well, I was finding that some of my stress responses were changing in a more positive way. And what happens is, like, when there's chronic pain in the body, our brain learns to respond to this chronic pain as a threat. So when the pain rises, everything in our body and mind kind of get put on high alert, ready for that fight or flight again. And when I was able to kind of move away from that, and these were things happening kind of internally that I wasn't even fully conscious of until I was noticing after that I wasn't having some of my automatic reactions that I was used to. So when I was in that state of higher pain and higher stress, little things would give me a pretty strong emotional reaction. Like, I would drop something on the floor and have a really strong anger response, and be highly emotional about it, and it's such a simple thing and an easy fix, but my pain and stress was making me less tolerant of myself and also people around me, unfortunately. So I was kind of noticing this space of being able to choose a different thought or a different response when something would come up. So, thinking about dropping something on the floor, I might have that action happen and then realize, like, oh, it's no big deal. Everybody drops things. And I would have that be my next thought, and then kind of take a step back and realize, like, oh, that's different. And that's the type of thing where I started to see that the yoga, mindfulness, and meditation practices were actually having an effect on my life and my inner workings a little bit that way.
So were those the three sort of tools that you use to help with your pain management? Okay, let's dive into meditation now. Because you mentioned that with yoga, it was in one particular form. It was, you had many options to choose from depending on how you felt. If it was, more of a painful day, you probably went into more of a restorative type yoga practice. And if not, then something that required a little bit more energy. So with your meditation, some people hear that and switch off and think, not for me. I can't sit still. I can't sit with my thoughts. I can't quiet my brain.
Right.
I did 3 meditation practices yesterday because and I was one of those people. And, one day someone said, you need to meditate, your stress level's too high. And I said, what? Me meditate? No chance. Like, how? And
Right.
she recommended guided meditation. And I did a guy named Michael Seeley who has the most amazing voice ever.
Mm,
And I practiced this, guided meditation. You just literally have to lie there and somebody carries you through a beautiful meditative practice. And the end result is, I mean, for me, if I'm going through a really difficult day, if I'm really stressed or I feel anxious or I feel worried or I want to bring something into my experience, if I'm working on a particular like manifestation thing that I want to bring in, meditate. And it just takes you to a zen level. Like, you just feel amazing. So talk to me about your meditative practice and what types of meditation you did and how that helped with managing your pain.
absolutely. I was the same type of person where I thought, there's no way I could meditate. How do you
Yeah.
clear the thoughts from your
Yeah.
mind? It just seems impossible. And it really kind of is. But for me, breathing was my introduction to meditation.
Okay. That's
So,
interesting. Okay. I
yeah,
never thought about that. So okay, talk to me about that.
right. With
Mm.
breathing practices, you are focusing your mind on one thing. Very often it's the sensation of breathing. And that is a type of meditation, to use the breath as the focal point. So I was doing breathing practices most often as part of my yoga. I did a lot of online yoga classes, especially in the beginning of my practice when I didn't live near any type of studio. And breathing practices gave me that little way to kind of settle in. So, very often we would do a breathing practice at the beginning of a yoga class and then end with some type of meditation at the end. And
It's
the
good.
breathing, I'm sorry?
I said that's good.
Yeah.
It sounds really nice. Yeah.
Yeah, yeah, it was a nice way to kind of begin and end and make it a full, complete practice. And so I didn't even really consider breathing as meditation at first, but then I realized as I learned more that I was directing my focus to something specific. And when I would start thinking, I would bring myself back to the breath. And that's what meditation is. We're not trying to clear our thoughts, as a lot of us think, but it's instead being aware of when thoughts come in and then just coming back to whatever your point of focus is, whether it's the breath, feelings in your body, something different.
So how would you recommend someone with, you know, long term or maybe even short term pain that comes and goes? How would you recommend them starting a meditative practice? And how, is it sort of like for you in your experience going with how you feel each day, or did you start with, okay, I'm going to meditate first thing in the morning and last thing in the evening every day, just so that it builds that consistency? What are your recommendations there with advising on how to get into that for pain management?
I would say start small. I know when a lot of times we try something new, we might have a lot of energy and excitement around it. And we think, okay, I'm going to do this 30 minutes a day. And then, one day happens and life happens, and then we skip, and then we feel like we can't do it at all. So, even like 2 minutes of a practice would be a great way to start and build. Um, Meditation doesn't have to look any particular way. So people might think that it's sitting on the floor on some kind of cushion and having a certain type of posture. But for some people, sitting on the floor like that is not comfortable. So laying can be a fine way to practice meditation. You can lay on your back, maybe it's on the floor. If it's on a bed, you just have to be aware that you might fall asleep. So
I
you
sleep
might
all
use
the
an
time.
alarm. Yeah.
Yeah.
Um, but either way is a great position to just practice breathing
Mhm.
and coming to that diaphragmatic breathing where you're breathing down into your belly, trying to send your breath all the way into your belly. And then trying to, at the same time, keep your chest pretty still. So your belly is moving, but your chest is not really moving. And you can even kind of place a hand
Yeah.
there, one hand on your belly,
Yeah.
one on your chest, to see if they're actually doing what you are trying to make them do.
Interesting technique. Yeah.
And, that's a great way to start meditation and begin regulating your stress response around pain and stress.
So, in a nutshell, these three practices, meditation and meditation and yoga, sorry, and breathing,
Mhm.
changed your body's response to the pain. And this is why it's worked for you in making the pain that you deal with every day more manageable, right? Or have you also noticed that the pain levels have decreased as well, or are you just more tolerant to them?
I would say some of both. Yeah, I think, the process of learning how to be more sensitive to my body and what's happening and just the lifestyle changes I've made have really helped. And I think that has probably decreased my pain and my perception of the pain, as well as what I will do to respond to that pain when it happens, if that makes sense.
Finally, about, was there anything else that you did in this process to support this journey? And when things became challenging, so I would imagine that there were days when maybe you're practicing yoga and your meditation and your breathing, and maybe you weren't feeling like it was doing much. I'm imagining that might have happened, might not have happened. What was your mindset like to keep you through? Because a lot of the times we give up when we need to be persevering, and oftentimes when we give up, it's at that crucial moment where we start to embed that behavior as a lifestyle, or that practice as a lifestyle. So talk to me about that. How did you allow yourself to be so patient enough to see it through when it became difficult? Mindful, I can't even talk.
Yeah.
Mindset
Yeah.
wise.
Right, right.
Yeah.
Yeah, it's tough because those, like you said, those days when we want to give up are the days that really matter in staying consistent when we're building in those more positive habits for our health. And I knew that if all I did was spend a few minutes relaxing on my mat, sometimes it doesn't even really look like yoga when you're in some restorative poses and laying there and breathing. But by doing just a few minutes, I knew I was doing something good for myself, even if it didn't feel that great in the moment, even if my thoughts were a bit anxious. Even still, there are those days of doing a practice where my mind is just a little bit more scattered. Maybe there's some other stress going on in life or the world, and, it's not the ideal practice, but I know I'm still sticking to the habit. I'm spending that time to take care of myself, which, self care has those positive benefits for our stress and well being. And, even though it might not feel like the best practice, my intention and my action are there. So having the intention to do something good and then following through on it with the aligned action to carry it through.
I love everything that you're saying. Absolutely love it. Final question for me. Were there in this approach to, because this is a lot of big changes that you've made, were there any things or any people that you had to remove from your life to support these new behaviors that you were doing? Because a lot of the time we may have the intention to do something great, but we don't necessarily have the environment that supports that intention. So how did you set your environment up to support your healthy lifestyle?
Yeah, I think I just started to make my self-care and wellness more and more non-negotiable.
I love that. I love that. Yes, that's so
Yes.
super important. You hit the nail on the head there.
And
Yeah.
that's what I talk about now is being so lovingly committed to our own self-care that we might have to give up certain things that aren't really serving us and might get away in the
Mm-hmm.
way of our
Mm-hmm.
self-care.
Mm-hmm.
Um, and, sometimes it's having those discussions with people in your life, maybe the people in your house, like, look,
Mm-hmm.
I need this 15 minutes to myself or whatever it is. I need this time to take a break. And, hopefully the support is there to, be able to make that work. Sometimes it's a matter of being a little bit more flexible. Maybe you have to take those 15 minutes later in the day or earlier in the day, but finding that time to do something for yourself every day, I think is really important. And also just kind of staying in touch with yourself throughout the day. So your physical body, paying attention to how you're feeling in your body, but also your mind, your thoughts, your emotions, and just seeing like, how am I doing? What do I need? And what can I do to take care of myself? Especially if it's a difficult moment or you are realizing there's some challenging thoughts or emotions coming up, what can I do to take care of myself well? Do I need some healthy food? Do I need a little rest? Do I need someone to watch the kids so I can just have a moment to breathe, go outside for a little walk? Just finding these little ways to stay in touch with ourselves, especially now when, our lifestyles are so different with conditions that we're working with. that I think where a lot of us might be holding on to some of this stress internally, and some of our regular stress outlets aren't really available. So it's finding those creative ways to make self-care more of a part of our day to manage that stress.
Add in like not feeling guilty and giving yourself permission to do that, because a lot of the times we know that we need to stop. I love what you said about checking in the day. A lot of people might not do that. So it's a fantastic thing to start doing frequently throughout the day. How am I feeling? What do I need? And when you identify that, not feeling guilty, to follow through on what you actually have identified you need, and giving yourself permission, an uninhibited permission to nourish yourself that way, because it's almost like you can't give from an empty cup. And I never understood that, because people use that all the time,
Right.
but you genuinely cannot give what you do not have. And if you think about, like you said, the conditions that we're living in now, and not having the normal outlets to go to release and revive ourselves, it's so much more important now than ever before that we are taking the time to lavish ourselves with self-care in whatever way that looks like for all of us. So it might not be a yoga practice, it might not be meditation, it might not be breathing. I hope it is one of those three, because I think they're deeply restorative, but it may be something else. And it's so,
Right.
and a lot of the women that I work with, and myself included, feel so guilty, like, I should be with the kids or husband or cooking or cleaning or doing something else, and you put yourself last. So I think that's a super important thing, to be aware of. Figure out what you need, and give it to yourself, and bring that element of flexibility in there. Okay, I might not be able to do it now, but maybe I can do it later on in the day, or earlier in the morning. But just make sure you do it. So
Absolutely. Yeah, if
yeah,
I can add on to that,
absolutely.
I love to talk about making self-care sustainable. So, not just doing something for yourself 1 hour once a week, but building in those small little things you can do during the day and keeping it short, simple, and sweet. So, simple, might be eating healthy food. Maybe it's drinking a little more water. Just standing outside and breathing fresh air for a couple minutes. It doesn't have to be as complicated as we might think. And,
Mm.
short, like I was saying before, 2 minutes, 5 minutes, just taking that little break for yourself, and then making it sweet, something that you enjoy, whether it's a hobby, a short chat with somebody who's supportive and positive in your life. But I think those three things, simple, short, and sweet, are really helpful to keep in mind for sustainable self-care that you can continue and maintain throughout, regular life as well as in this unusual lifestyle we're all in.
That's That's superb, because it takes away any sort of barrier to anybody being able to do it. Simple, short, and sweet. Like, you
Absolutely.
definitely can find the time in 24 hours. That's brilliant. Thank you so much, Courtney. Can you tell our listeners where we can find you on social media, if you have a website at all?
Absolutely. I do have a website. It is my first and last name, Courtney Johannesson. I'm also on Instagram, Courtney Johannesson, Facebook, and I run a Facebook group as well for resilient and empowered women. So I can be found in all those places.
Love that. I hope you guys check that out. Thank you so much. I wish you all the best on your journey. Thank you so much for sharing your story. I know this is definitely going to help a lot of people who listen to this interview today. And I feel like I'm going to do some yoga after, because it's so relaxing talking to you. So thank
Amazing.
you so much, Courtney. It's been a pleasure to speak with you.
Thank you. You as well. Have a great
Right.
day.
Likewise. Take care.
Thank you. Bye.
Bye.